The ACL, or anterior cruciate ligament, is one of the four major ligaments in the knee that connects the bones together. That's what ligaments do. The collateral ligaments are the ones on the side, stabilize the knee in the side-to-side motion. When injured, they usually heal by themselves. The ACL is the one that gets all the publicity. It is the ligament that protects the knee in the sense that it keeps the shin bone from sliding forward on the thigh bone, and it also protects in rotation. Everybody who has injured their ACL will present with some sort of trauma. It usually presents with a pop or a sensation of a pop, sustained often during sports, but not always. There's usually a sudden onset of pain and swelling, and it's usually debilitating. Occasionally athletes can continue to participate after having sustained an ACL injury. As long as you can completely extend your knee and bear weight to a degree, there's no reason to go to the emergency room. Certainly it's important to have neurologic function, be able to feel your feet. Other than that, it's not a reason to run to the emergency room. However, you should see a physician within a week. Non-operative treatment is always an option. Most of what I do involves elective surgery. The ACL does not heal by itself, and it debilitates different people to different degrees. Because it protects in rotation, its job is to protect the meniscus cartilage. So when you hear about people having arthroscopic surgery for torn cartilage, what they're referring to are two little C-shaped pieces of rubber that sit inside the knee that really are the most important aspects of the knee, and the ACL is really just to protect it. Some people can function without an ACL. I see people frequently that didn't know they torn their ACL. It was certainly long before we had more experience with it, and they have led completely active lifestyles. At the same time, I have people that are typically less active that I will attempt non-operative treatment in, who will come back 3 to 6 months after doing extensive rehab and will say, I cannot function with my knee as it is. So it does affect different people to different degrees. Surgery involves rebuilding the ligament. In the 1970s, the doctors attempted to repair the ligament, and that didn't work. So what we have to do is we actually have to take a piece of tissue and reconstruct the ligament. The options are to take tissue from your knee, typically the hamstring or the patellar tendon, but the quadriceps tendon is also an option, and these are tendons. Tendons connect muscle to the bone, and they're found around the knee. Or you use a tendon from a donor. My goal is to get people walking pain-free as soon as possible. Certainly by 3 or 4 weeks, I like them to come in walking without crutches or brace, feeling and looking as though they had never had surgery. However, I won't start extensive rehab until they have full motion. Motion's important. I want them to control their swelling. I typically have them start jogging by 2 or 3 months, but not participate in any sport-specific drills for 4 or 5 months, depending on their rehab. And then returning to sports is tolerated by 6 months if they've done their job working hard. The rationale behind that is twofold. Number one, they need the ligament to actually heal to the bone. Your body uses what we put in there as a scaffold to rebuild a new ligament, and that actually takes 1.5 years. In the past, we used to keep people out of sports for 1 year, but realized that with extensive rehab, we can get you back to sports sooner. The other reason is the rehab. It typically takes 4 to 6 months for people to get their quadriceps strength and their hamstring strength and their muscle control back. In the early phase, rehab is focused on isometric activities, which means that we do controlled muscle contraction without moving the joint, but we usually start moving the joint passively. Then once the flexion allows, usually past 90 degrees, we try and get you on a bicycle and progress your strengthening as motion, pain, and swelling allows. The two most important things for a doctor to focus on when evaluating an ACL injury is there an injury to the meniscus cartilage, which I described earlier, or is there an injury to the other ligaments in the knee, such as the PCL or posterior cruciate ligament, the collateral ligaments that I discussed earlier, or the posterolateral corner or posteromedial corner for that matter. These are all just networks of ligaments around the knee that all work together to stabilize it. Typically when the ACL is torn with other ligaments, those ligaments don't usually heal by themselves. The MCL is probably the second most talked about ligament and usually does heal by itself. It has a tremendous healing capacity in most cases. The LCL and posterolateral corner are often injured together and usually require surgery more urgently than the ACL. At St. Luke's Hospital, we have fellowship-trained orthopedic sports medicine specialists. The recovery from ACL injury involves a team effort. We also have therapists that have extensive experience in rehabbing these injuries. And I tell patients frequently that at 6 months, when they compliment me on doing a good job, I really turn the compliment around. Because as much as I would like to take credit for it, as a surgeon, my job's usually done within a couple of hours.